Thursday.
It is another Thursday, and that came by so fast.
It's tea day.
It's crazy.
Yes. Topic today is a biggie. It's PRF EZ Gel.
Yes, we're so excited to talk about this. We brought this on last quarter into the practice. Something we've been really wanting to bring in because we just want that natural treatment for patients.
It's been on our...
2025. We said that last time. It's the year of the glow and the natural.
Well, let's see. It's been on our list for a while. PRF EZ Gel has been around for a couple of years.
Yes.
PRF has definitely taken the internet by storm, I would say. People are really moving towards more of those natural treatments. I know last week we talked about filler and how we can have very natural looks with well-placed filler. And this is a natural filler.
Yeah, I love that we just have an option in our toolbox for patients that, number one, can't get filler, and there's like a whole thing we can go down a rabbit hole with that, or patients that maybe didn't have good outcomes, don't like filler, or have had filler but need just a little something extra to enhance their filler treatment. Yeah. And so that's really great that we have this. I mean, it's been amazing in the practice. Just the last couple months, I've seen an uptick in my patients.
I'm literally preparing PRF EZ Gel as we are speaking.
You are. She is.
So let's talk about what that is. We've all probably heard about PRF. This is platelet-rich fibrin. We do a blood draw, and we are grabbing that plasma that is very rich in growth factors. We are also utilizing it to create a filler gel out of your own blood, which sounds pretty wackadoodle.
It sounds like you would add something to it, but you don't.
No, it's literally just from your blood. It's the way we process it. So there's a heating component and a cooling component. And without getting into too much science and nitty gritty, we are able to create a thickened gel out of that with the added PRF, PRP benefits, which you don't get just from regular filler.
Right. I love this because it's biodegradable. It doesn't have any additives or chemicals, nothing to like enhance the product. It's all you. It's all made from your own blood and PRP. And this is really good for patients that also have health issues, or swelling issues, autoimmune issues. So basically just about anyone is a candidate for this procedure.
What's nice is you're not going to react to it. This is your own body. So we're just literally injecting your blood back in, just in a different form. There can be some initial slight swelling, maybe some bruising from the pokes, you know, it's a needle in your face. There's only so much we can do. But I've been getting texts from my patients, one of them in particular whom I love, said the next day she woke up and her husband said she was a baby angel.
Yeah, that was really sweet. And let's talk about the volume you get.
Yeah.
So with a typical blood draw, we get about 4 to 6 cc's of PRF, which if you break that down into like a filler syringe, one syringe of filler is 1 ml. So when you're buying filler and you're only treating with one syringe, it's 1 ml. With your own blood, you're getting up to 6 in some patients. Yeah. Just depending on, you know, your hydration status and everything. But we can really utilize all of that product and treat a full face.
Well, right.
And that's what we've seen a lot of benefit. Like, you don't have to just do your under eyes anymore. Sure. We can do full face rejuvenation with those, you know, syringes, and that's been fun.
We've been injecting PRP under the eyes for many, many, many years.
Yes.
And it's a wonderful treatment because it does help strengthen the tissue under there, brighten, and do all of that for the under eyes. But with the PRF EZ Gel, it's also volumizing the area. I know sometimes not everyone is a candidate for filler under the eyes because it can draw water. There can be some swelling and puffiness and little things like that. And this doesn't have those same drawbacks. We can also then tailor that treatment specifically to what works best for your face. So, you know, working in the temples or back here for the, you know, more rejuvenation that we lose with age back in this preauricular submalar area, and those other weakened areas that happen over time with aging.
Yeah, I think we can talk about benefits. So we can fill in hollows. This helps with brightening and lightening, texture,
skin quality.
Absolutely, fine lines and wrinkles, and just overall glow, rejuvenation. I mean,
and we're seeing
gold in this is
Yes, the liquid gold.
It's liquid gold, and it's gold.
We're finding that most patients need probably 2 sessions, 4 weeks apart. Some people need 3. That's something that we determine with you based off of your goals and how your body reacts to that. And then we might repeat again in 6 months to a year.
I get a lot of questions. Can I combine this with filler? What would you do?
Yeah.
Typically, I say if you're very hollow, I would treat with your filler first, let that settle, and then do your PRF. Or if you've already done filler in the past, there's no harm to adding PRF to that. So
Yeah, I agree.
yes,
with
you can combine. It's nice to do multi-modality sometimes if you're really trying to get a goal. Especially if you're like doing contouring and things like that. You're not going to get a lot of contour from PRF. It's not like a hard G prime, like, you know, thick product. So if it's something like you want to add contour to your cheeks or sharpen out your chin, obviously filler would be the better route for that, and then adding PRF around that area.
Totally.
Cool.
I think we'll be seeing a lot of this in 2025.
Yes.
I think it's going to be one of the hottest modalities that we have.
It's pretty popular on my feed right now, and so it's really cool to see our community. Everyone else is getting really busy with it too.
Yeah.
So
All right.
we're all doing the right things.